name is Daphne Broadhurst. I'm a clinical nurse specialist with Infusion Excellence Consulting. When you're using the Surefuser, you always need to make sure that it and your IV are working well and that you're responding to your medicine as expected. You need to be able to notice if there's a problem and what to do to fix it. Let's look at what might go wrong and what to do. Remember though that these tips are just guides for you. The video will provide general information. Make sure though that you follow the information that your healthcare provider gives you. Always check your Surefuser pump before you use it. Do not use the pump if it's past the expiry date, if it's the wrong name or the wrong drug on the label, if the balloon splits or leaks or fluid has leaked, if the cap on the end of the pump is missing or the cap on the top of the pump fell off. If you don't use a pump because there's a problem with it, you'll need to tell your nurse so that they know you'll be short one pump. They may ask you to keep the pump to send back to the pharmacy when the next order is delivered. If you see the pump leaking while it's running, close the clamp on the pump tubing. Check that the connections between the pump and your IV are secure. Take the tubing off the IV or PICC. Flush the IV or PICC as trained. Put the pump in a plastic bag and tell your healthcare provider about the problem. If it's taking longer than you were told for the pump to empty, there's a couple of tricks you can try. If you're in cold temperature, place the pump under your clothes closer to your body. Did you remember to take the pump out of the fridge before it was time to give your medicine to let it warm up? Is the flow regulator taped to your skin? It controls the speed of the flow of medicine. It needs the warmth of your skin to flow at the right speed. As your chest and abdomen tend to be warmer than your arm, you can tape the flow regulator to your chest or your abdomen for more accurate speed of medicine flow. Make sure that the top of the pump is close to the same height as your IV or PICC. Look at your IV and the tubing to make sure it's not kinked or bent and blocking the flow. You can try tapping the filter with your fingertips while holding the filter straight up and down. Are there any clamps on the tubing or the IV or the PICC, and are they fully open? You can disconnect and try flushing your catheter, but make sure you keep the end of the tubing clean. If the pump still won't flow, call your healthcare provider. If the balloon is emptying faster than you expected, you can check for a couple of things. Is the pump exposed to really warm temperatures or in the sunlight or perhaps under your bedclothes? Take your temperature to see if you have a fever. Heat can make the pump flow faster. Was the pump in a position higher than your IV or PICC? If so, the height can make it flow faster. Keep it close to the height of your IV. If you notice air bubbles in the pump or the tubing before the filter, the rectangular filter will expel air so it doesn't get into your IV or PICC. Sometimes air bubbles can get trapped in the back of the filter. If so, you can tap the filter with your fingers to remove air bubbles. Signs of an infection. You may have a fever, or you may have an infection at your IV site if your skin, where the IV enters or PICC enters your body, is red, warm to touch, swollen, or tender. There may or may not be pus or discharge under the bandage. If you notice any of these signs, call your nurse or doctor, or go to your emergency if you're sick. Follow your healthcare provider's instructions. Call the nurse if your bandage is loose or dirty. It likely needs to be changed. If you weren't shown how to change your bandage, call your nurse to get the bandage changed. If your catheter won't flush, make sure the clamp on your IV or PICC, if there is one, is open. You can try moving your arm, coughing, taking a deep breath. And when you're flushing, you can gently push and pull on the end or the tail of the flush to try and push the saline into your IV. Remember though, never push hard. If it still won't flush or it's getting pretty hard to flush, call your nurse so that they can check it. You've learned what the Surefuser is, and you're learning how easy it will be to use it. This concludes this video series. Hopefully you'll find, as other patients have, that it's actually pretty easy to use the Surefuser in the safety and comfort of your home, at work or school, or even on vacation. I'd like to thank CardioMed for their educational grant to support the development of this video. Thank you. You've learned some tips so you can safely and confidently give yourself your own IV medicine. Thank you.